all this possible. Hey, what's up? Jimmy McGill again. Not Jimmy McGill again, but Jimmy McGill again. Okay. Hey, sorry about that. We are under attack by weather demons, and you know that's the way the enemy works. You know what I mean? I'm a spiritual person, so I don't know about you guys. I always think about you know, the enemy is over technology, you know what I mean? And you bite like the Adam and Eve bite the apple. And why do we got apples on the back of iPhones with a bite out? You know, he's over, he's interfering in, all in the radio waves and causing defects. So thank you guys so much for coming back in. Perfect time. We get to hear about Misty Evans, woman in long-term recovery.
Yes. So
talk to us.
Hey, I'm here. I'm a person in recovery 4 years now.
4 years? Mm-hmm. Clean? Like, clean. What does that look like?
Straight clean, nothing in my body.
What?
Yes, no mind, mood altering substances. Straight clean.
And
so
straight clean.
And so that gives you hope, right?
That's a good count.
I was able, I started using when I was 12.
12?
12 years old. 12 years old was my first substance in my body, and by 14 I was an IV user. Yes. So
how long did that last?
So that lasted up until I think I was in and out of institutions from 12 to 15 and a half, and I went to my first treatment center for 5 months, and I just stopped using one substance and switched it for another, right? And that lasted for another 4 years. I dropped out of school. Convinced my mom to homeschool me. She was homeschooling me, basically, where you don't get in trouble. And so eventually I moved out of my mom's house at 18 and started doing modeling here in Little Rock. And that was my first trip to ever at the Riverfest. And so it was super exciting. But then so I started to think that I wanted to go back to school, right? So I got into an alternative school in Siloam because I didn't believe that I was smart enough to get my GED. So I was like, I've got to get back into school to make it easy, right? Because I'm always looking for the least resistant way.
The softer way.
Yeah,
for sure.
So I ended up graduating and I had my daughter and ended up started using again. Mm-hmm.
So how long were you an IV drug user?
For 16 years.
Started using at 12 years old in Arkansas, right?
Yep.
And so for those of you who are watching out there in social media land, in case you don't know, Arkansas has one of the highest rates of teenage use from the age of 12 to 17. And Misty is evident of that. Started at 12. And so, but now, despite that history of IV drug use, you are the peer recovery supervisor for Dori at Bradford Health Services.
Yes.
Wow.
Yeah.
So anytime...
She's all the things, actually. Like, she needs a title that goes like Misty Evans, peer recovery supervisor, and all the things. Because she does all the stuff.
Yeah, I get it. So, well, supervisory, it becomes less about providing service and more about administrative work, right? Yes. And so that's totally cool. So if you could sum up what you do for Bradford, coming out of a, what was it, 16-year IV drug use?
16 years.
What would that one word be?
God.
Woo! Well, watch it. They'll cut the airwaves again.
Sorry. I mean, but it is what it is, like, right? Like, I mean, to be sane enough to be still sitting here and have, with all of that, I'm surprised that I'm not permanently insane, like for the rest of my life. Some of us don't get the gift to come back and help others, and we get stuck in that.
Yeah. So I want to tell you, it seems like you've got a little cult following over here. Like Misty Dawn Evan is the bestest. Misty is the man. Go Misty. Like, I mean, what's going on over here?
So, I help a lot of people, like I don't, I believe in everyone. I just want to, if I was able to do it, you know,
Anybody
can do it.
Facts.
Because it's just, it takes my breath away just thinking about it.
Yeah.
It's crazy.
And it's so hard. It's interesting for us too because, you know, I've been working next to Misty for 3 years now, almost 3 years, and she'll start telling us stories about her days of active addiction and talking about the things she did. And
you can't even see it.
I can't even see it.
Yeah.
I mean, and we all just sit there and, I mean, you know,
Like, is she making this up?
There's no way. And I think the favorite one was when we were talking about the COVID shot, the vaccine shot, and Misty's like, I don't want to put that in my body. And we're like, Misty, you were making meth. Like,
yes.
what are you talking about? You know?
Fact.
Worse in your body, you know. And we worked through that, but it's been amazing working with her and watching her grow and just take our program.
That is so cool.
You know, peers were a new concept when we first kind of started at Bradford, and now it's instrumental in what we're doing at St. Vincent. So it's really cool to see her grow, and she's amazing.
So I got to say, and I can validate this, right? Like, because I am the state of Arkansas's recovery manager, which means I manage all of the recovery initiatives that is state funded. And so I can honestly attest that Bradford Health was one of the first treatment centers to hire a peer out of their own budget.
Correct.
You know, and so that shows buy-in, early buy-in, that you guys believe in people in recovery, that your policies and procedures should reflect those beliefs. And so Misty and I were talking about your program before you got here, Dori. And so I want to share a little bit. If it was not for the state drug director, Kirk Lane, fighting for me, fighting for Ashley, who's a new employee that's working with me at DHS. We both have backgrounds, right? Like, he knew what he was fighting for. He believed in it. And so we were actually comparing you to Kirk because, well, I had always been a little bit concerned because of the scrubs, right?
Right.
And so because peers, we dress like we dress. This is my daily outfit. And because we have to be identifiable. And so I was like, man, that's scary. And Misty's like, no, we don't wear scrubs no more. Dori did that. And I said, okay, go Dori.
Yeah.
So,
and you know what they all said to me after fighting that for a little while?
What?
We kind of like the scrubs now.
It was so comfortable. It was comfortable, I gotta admit. I mean, it was real easy. You know?
That's cool.
That's just part of the, you know, we moved into a hospital and it is the hospital's been super welcoming and wonderful, but it has been some of those little things that you don't think about, like scrubs and that peer role, and what does a peer do in a hospital, and so it's evolved, and I don't think that we could have evolved and had such a strong peer program if we didn't have somebody like Misty in the lead that's like taking it under her wing, and by the end of it, when we're fully staffed, we'll have 6 hired peers.
So that's
we'll have a peer at our office 7 days a week. 8 a.m. to 8:30 p.m. They do groups. They're an integral part of our treatment team.
That's freaking awesome.
Yeah, it's really great.
So that's that shows the overwhelming need for peer supervision, right? Like, you're a master level social worker, right?
Yes.
So Dori is top of her game, right? As far as your license, is there?
I have an LCSW, so that's the highest licensure you can get with the master.
Okay. Now, would you try to supervise a medical student?
No.
Absolutely not.
Outside of my scope of practice.
Right. Same thing with a peer. It is a very unique role built off of lived experience. And never in the workforce history of the United States of America has there been a job description based off of lived experience.
Right.
So it's going to take you to, because what you can do actually goes against your ethics, right?
Some of them, and that's kind of one of the things is, you know, with social work too, it really depends. And this is the difference with treating addiction versus
mental
health. So
right.
I can do both as an LCSW and as a therapist for, you know, I've 21 years before I actually started doing program development and all that, which is what I love to do. But
me too. Favorite part of the job.
I love doing stuff like this. But as a counselor, if I'm treating just mental health, I let the patient kind of self-guide their way. It's like they need to find their direction through different tactics and techniques to help them get there. In addiction, which is why I love it, we can be real and honest.
Yeah.
You know, letting our patients find their way, that's not going to work. So we're able to be a little bit more directive with what we do.
Right.
But I mean, I can get in and do that, but that's not my skill set anymore. They're
Yeah.
going to get in and try to do therapy.
Right.
But as
Right.
the two marry beautifully. I mean,
Right.
that's the thing. I can handle the underlying mental health issues with our clinical team, our therapy staff, and then the peers come in and share
On
their
the
lived
non-clinical
experience
side.
on the non-clinical.
I
And
love
she's
it.
already saved, we opened our unit March 23rd, I believe, and our first patient was really struggling being there, and Misty saved it, and she was going to leave, and Misty's like, let's go for a walk, and Misty intervened, and
That's awesome.
and she stayed. So she prevented a patient from leaving. That patient was there, it's been there 14 days now, and I mean, it's a therapist could have tried to do that, and we probably would have been okay in doing it, but she was more successful because she was able to sit down and say, man, I've been there. Like, I
Yeah,
know
it
what it feels
sucks.
like
I
to be
get
here.
it.
It sucks being here, and I know you're lonely and you're scared and all of those things, and it just really made a big difference. And
Yeah.
so I have seen, since we've been open, even the hospital are seeing their benefit, and we're getting calls from other floors, and we're getting calls from the ED, and like they're seeing how our peers are really helpful and essential in our treatment.
Yeah. So, well, let's talk about that. Let's talk about Bradford Health is in the spotlight right now because of a really big merger. So what does that look like?
So it gets a little bit confusing, but we partnered with St. Vincent's Hospital here locally, the CHI St. Vincent Infirmary. We've
Okay.
been working on this for, about a year and a half. The pandemic slowed us down, and a couple other things did too. But so basically what we've done is, Bradford Health has been treating addiction for over 40 years. We have treatment facilities in 5 different states. We opened the Little Rock intensive outpatient program 6.5 years ago. And so due to several different reasons, lack of treatment here in the state of Arkansas, insurance companies not letting people go out of state, just many different reasons, we
Right.
started discussing a partnership with St. Vincent. So we've essentially picked up our residential treatment program that we have in Warrior, Alabama, and we
Okay.
have put it inside of St. Vincent's Hospital. And it sounds kind of crazy. So the programming, the management of the unit is Bradford Health.
Yeah.
But everybody else is an employee, but it's a St. Vincent's program. So St. Vincent's does the billing, the insurance, the employees are St. Vincent's employees, except for myself and one other person. So we brought all of our team over with us. They are all St. Vincent's employees now, but Bradford is managing the unit, is Bradford programming it, is Bradford structuring it. So it is a true partnership. The cool
neat.
thing is we're on the old labor and delivery unit. So I feel
Oh,
like
okay.
we're, rebuilding lives again and rebirthing a little bit.
That's
It literally started on sitting down with Dr. Jones, the medical director at St. Vincent's. We went to lunch one day just kind of talking about what this would look like, and by the end of it, we're writing out ideas on the back of a napkin at lunch. And so
love it.
And here we are, a year and a half later, going to be we'll
Up
have
and running.
Yeah.
when we're
Running.
full capacity, we'll have 10 detox bed and 30 residential beds.
So it's full treatment center inside of St. Vincent's.
Yes.
Correct.
And you offer detox.
Yes.
Yes.
You offer clinical treatment, counseling, therapy, and peer support.
That's right.
And we also have our intensive outpatient and our outpatient. So literally, if you start from day one to the end of our treatment, it's about 90 days worth of treatment. You can stay on for up to a year or two
Yeah.
of continuing care. When we're fully staffed, we'll have 8 licensed master's level counselors. We'll have 6 peer recovery support. We have a recreational therapist, a dietitian, and we have a full nursing staff and medical staff. So we'll have, I think at the end it's something like 70 employees, but we have nursing, we have patient care techs that will help with the patient's peer support,
Yeah.
clinical,
And we all mesh well together, like the patient care techs, peer support, and therapists. So we all work together in this dynamic of recovery-oriented, person-centered, kind of like just being real and being supportive and encouraging. And that is beautiful.
Yeah.
It is so beautiful watching the process since we have opened, just all of the teamwork together.
Yeah.
And learning. We're
learning,
learning a lot of
yeah.
stuff, and we learn from each patient,
Yeah.
and each situation, but it's definitely it's an exciting thing because we're getting to help people, and that at the end of the day is what is important.
So, how does a person get into Bradford Health?
So they would essentially call our 501-725-800.
Can we get that
Is that real?
typed? Can we
Yeah.
get that typed in? So, if you're watching, or you know somebody who should be watching and they're not, you can tag them, or you can share the phone number
Yeah.
with it. What?
What's the
2-501-725-8000. And so you essentially will call that phone number.
Okay.
A person in recovery will answer the phone.
A real person.
A real person.
Not a robot.
Not a robot.
Okay.
And
Now we're
so-
talking.
Unless we have so many calls going that we can't get to it, then it will go to our call center in Alabama.
And
But even there, there's a person.
And so the person who answers the phone's in recovery?
Yes.
Okay.
Yes. Is in recovery, has some type of lived experience. So that's the cool thing about the St. Vincent is we are kind of hiring a lot of people with some recovery based experience.
Yeah.
So that way, you know, whether that's whatever,
Yeah.
they're able to kind of, you know, identify and relate to people that they're talking to.
Do you find, Dori, that people in recovery tend to work hard?
You know, I think the people that I have hired are amazing workers. You know, I do think that there is a honor and like a taking ownership of where they've been in their life and the opportunities that are in front of them. I think there might be a little bit more of appreciation for what their role is.
I see that.
I would say that before we moved over, because now our staff is so much bigger, but we had probably 50-50, and I've always believed in hiring people in recovery that really have and staff that really cares and compassion. You know, at the end of the day,
It's
I
awesome.
hire good people. I mean, if I want to brag on myself on anything, I hire good people, and that makes a difference because if you provide good care to your patients and you provide good quality treatment, you don't have to work hard.
Right. Right.
You know, and that's I think what we've done.
And for people like Misty, this doesn't even feel like a job.
No.
This is what we
this
do.
is my life. This is what I do.
24 hours a day.
24/7.
Yeah.
24/7.
25/8.
Yeah.
Non-stop.
That's about
25 hours a day, 8 days a week. We trying to save lives.
Right. Yeah. Yeah.
Well,
Yeah.
and I know, like, when they call and they get the person on the phone that's looking for treatment, the peers will then do a consultation, which just gives us the basic information about what that patient's going through, why they're calling, and then we get their drug history, use history, consequences, all that, so that we're building the case for medical necessity to be able to get them the care that they need, and then motivate them for treatment.
And that essentially builds the relationship with the person calling.
Yeah.
Right. So like they're connected with me right when they call.
So, well, let me ask you this. So we've talked about how to get into Bradford. We've talked about all these services, and Bradford seems to be all inconclusive, very holistic approach, right? Is there any foresight in the foreseeable future of Bradford having recovery residences as a part of its programming?
So I think, it's important for us to remember that, yes, we are Bradford Health, but this is a St. Vincent program.
Yeah.
And so is there discussion about how do we grow this to be something different? Absolutely. Being part of a bigger health system, St. Vincent's is national. And so one of the things that I'm, kind of already got my eyeball on is that if this is working and we get all the kinks worked out here in Little Rock, why can't we drop this model elsewhere?
Elsewhere. Yeah.
And so, we like to partner with sober living homes. We think that's a huge part of success is being able to be in a sober environment for as long as possible. And we know statistically
That's
people
working.
that are engaged in longer care of treatment have higher success rates.
Yeah, yeah, for sure. I stayed in my recovery home for 13 months. Without that safe environment, surrounded by people who, don't get me wrong, there were some class clowns in there, Dori. There was some that, had their heads so far up their butt they didn't know which way they were going. But then there was a few of them in there that really wanted it. And them folks told me, they said, hey, 2 out of 11 of y'all are going to make it. The rest of y'all are going to be high. Listen, I don't know why they told me that terrifying stuff, but it scared the bejesus out of me. I started looking around the room trying to figure out who the other one was.
Right.
Like, I am not going to stop. Not me.
Well, that's what I did as I stayed in sober living.
For how
in
long?
Searcy. I lived there for 6 years. Now, 4 years clean, if that tells you anything, that director believed in me and had hope and gave me a chance.
Yeah.
And taught me things that no one could teach me, right? I didn't have a dad. I didn't have a mom. Yes, I have parents, but I never really had that role. So he taught me how to, Misty, it's time to get up and start a part-time job, Les
So
Tubbs
you-
was my IOP counselor.
Yeah.
I mean-
So I know you, and I know your clean time,
Yeah,
right? So
yeah.
you got 4 years clean.
Yeah.
And I know you've been living on your own for a couple of years. So you failed a few drug tests.
A few. I mean,
and they didn't kick you out?
So it wasn't like the first 30 days, like I got there, I relapsed, right?
Right off the bat.
Went right back to court where I was fighting this charge and, relapsed. And then I would stay, clean for maybe 6 months or something, relapse, And so, and then I had a year clean.
Now, did they know you were relapsing at the recovery place?
Yeah, 2 times they did know. And they took my keys and car away from me, and I was locked down for 30 days, I wasn't able to leave to go to the store or anything like that. I used to have to show my receipts of what I was spending my money on. Like, I needed that help because I didn't really know how to manage money, first of all, and I didn't know how to live different.
Yeah.
And so
they put their foot on your neck.
When I came back, they were like, Misty, what made you come back? And I was like, I have nowhere else to go. Like, I have nowhere else to go, and I really want to learn how to live different, and I don't know how. And I was being honest for the first time in my life, right?
Yeah.
But it took me a few times of falling down, getting back up, and learning from each experience.
Yeah.
And, that is the growth from it.
Dude. So I got to ask you this too. Did you ever see yourself sitting in a professional standing beside your boss, sharing openly without fear of being judged of the stuff you just said?
No, never could imagine that I would ever be sitting here.
Do you think other treatment centers have directors that
believe in what we do?
Yeah. To this level, to where, because I look at the dynamic between you and Dori, and you're obviously close. I would even say some mentorship is taking place.
This is who I want to be, like when I grow up, right?
Me too.
This is who I want to be when I grow up.
Just call me Jory. Jory.
Jory Sparkles.
That's funny, man. I want to check these comments out here. I saw some stuff. Patty Yeager says, that's my boss.
Which one of us? I'm not sure what's Patty's boss these days.
Oh, seeing people in recovery is a beautiful thing. Great thing to have for us addicts. I detoxed a few times at St. Vincent's, and the staff was great. That's awesome. Josh Ramsey says, awesome.
Whoop, whoop.
Sean McCowan says, my coworkers rock.
Hey,
Stephanie Stoltz says, well said, Dori.
I wonder what I said.
I don't know. Chelsea McGill is watching under my account and says 3 years. Geez, that flew by. She's talking about you working for Dori.
It did.
Crystal Holland says that's amazing. There's just a lot. You guys are going to have to go back and read through those.
Me too. This has been, I always kind of say, I don't really want the responsibility or the ownership of this because it's a team. I could not have done this without our team. I couldn't have done it without the support of St. Vincent's. What Bradford's been, they're in Alabama still.
Yeah.
And what's crazy about it is Bradford's been using peer support, just didn't cover it that. They didn't call it that for years and years and years. But that was kind of their model for years, was having peers. And I think what made us successful from the get-go is I've never had anybody in that position of answering the phone that was not in recovery. And I really think that makes a difference because I understand addiction. I have family with it. My uncle is, 30 years sober, thank God, but I remember when he wasn't. As a young child, I remember watching that and the drinking and thinking, what this is supposed to look like. But I can't sit with a patient and talk about my experience with addiction because I don't have it. Now I can talk her through the balances and the changes and the barriers and the underlying, how it works in the brain, and I can explain to them, what stage of recovery they're in. So I don't think you can be successful if you're not willing to acknowledge that you need both. You need therapy, which we are one of the few programs in the state that has all master's level therapists as clinicians.
And that's what I love about it, is because they're actually, so they're not just setting someone in to, CIT or something. These are mastered level clinicians that are doing these groups. And so they they are getting absolutely great treatment. And then the peer support coming in and sharing our experience with them, the relief, right? The relief on their face where they're like, oh, like, you know, like somebody I can identify with and relate to. So they're getting both of that.
And we're also, I think it's important to talk, every night at 7 o'clock, we bring a meeting in.
Yeah.
So we
That's
have
cool.
either AA, NA, Celebrate Recovery, Big Book Study, every night.
Pathways.
Yeah, some type of
Yeah.
recovery group.
Yeah.
That's cool. Self-help groups at its best. Yeah.
It's really, I mean, it's been fun to watch. I mean, I'm not gonna lie, hadn't always been
Yeah.
super easy, and we've
Yeah.
had some challenges, but it's at the end of the day,
And
we're
so
helping.
all this started with Dori and what's the doctor's name?
Dr. Jones and Judith Goodson. We have got to give Judith Goodson some
yeah.
love here, because if it wasn't for her making that connection for us and
Yeah.
being really supportive of people in recovery, then
And
it wouldn't
so,
have started.
so where was the lunch at?
It was at the Little Rock Country Club, I believe.
So
Judith set it
y'all
up.
just went out and had country club lunch.
Mm-hmm.
I'm gonna bounce some ideas. I'm just chit chat.
Well, we
And
sat-
by the end of it, you're taking notes on a napkin, probably writing a thesis.
So it's funny, we sit down and we start talking really about how do we get referrals from St. Vincent's, because at that point we were still intensive outpatient.
Yeah,
and,
the merger, the idea
that
of what
wasn't
you,
even,
yeah.
And then it was like, well, detox. We really need detox out here.
Yeah.
And Dr. Jones says, well, I have this big unit. It may be too big. And so the next day, after we're scratching out the unit and talking, the next day we're walking down, I'm going group room, that patient room, detox. I mean, this floor could not have been laid out any better for this. And I call my bosses at Bradford, and I'm like, hey guys, I need you to think big, and I need you to think different. And I threw out the idea to them, and they didn't hesitate 1 second. They were like, this is amazing. Let's start talking. And so then the negotiation started, and we had several different meetings, and they came to terms of the agreement, which I didn't worry myself about that. I let them do that. And then,
Yeah.
so we were originally supposed to open in July of 2020.
Yeah.
So they signed the contract right before COVID hit.
Mhm.
So COVID really put it, and what was bad about it is COVID really stopped us being able to progress on that unit, because they thought they were going to have to use it as a COVID unit because they had oxygen and air in it because of the mother-baby unit.
Yeah.
And what ended up happening is, I think it actually, you talk about God, there's nobody else other than God that could have had the timeline of the events that occurred, how we got where we were. Like, there's so much backstory that there's nothing, this was totally God-driven. And even opening late, and even the way we've had to open due to like kind of a staggering open, we brought all of our intensive outpatient over first, and then we were only able to open 17 beds to begin with right now. But I think that's exactly how it needed to happen, because we've been able to figure things out instead of, you do it right or you don't do it at all. That's kind of been my concept, and so I'm glad that we didn't open up with 40 beds, brand new intensive outpatient, try to work out the kinks.
Yeah.
So I'm really grateful for that.
Man, that is pretty awesome. So what is the length of the program? 30 days, 60 days?
So it's typically 28 to.
Well, it just really does.
Just
Unfortunately, since we are insurance driven,
Based.
it's going to be based off of what they approve for days. Our goal is at least 21 to 27 days.
Yeah.
We would love to do longer treatment because we know it's more successful, but that's why having that continuum of care is available. So they can go from residential to our intensive outpatient, so they're not just going back home, and there's got some support there.
So does the peer support continue with the person that leaves the treatment center?
Yes, absolutely. So as long as they want to continue to work with me, that is their choice. It's I'm here.
So that's what makes peer support
Right.
long lasting and
Right.
successful.
They can call us at any time.
Yeah.
We give our phone numbers.
Yeah, for sure.
And they call.
Yeah. So the services continue
That's
even
right.
though the inpatient stay may come to a close.
Correct.
Your recovery support, which that's a perfect fit because recovery is what's lifelong after
Right,
treatment.
absolutely.
And so
Yeah.
you're meeting these people mentally, physically, and emotionally and spiritually where they're at,
Right.
like literally in the community at times.
Right.
And walking through with them to meetings and court cases and showing them how to live like you said they did with you. They're holding you accountable. And
I had to have some direction. because I didn't know.
Yeah.
You know, I didn't know any other way to live.
It's like having a sober companion just walk through life with you.
And it's cool, you know, because I can be like, I can go to different meetings, right? We get to form their own recovery plan. Like it's not
a
hey,
treatment
you have
plan,
to
but
do
a
this.
recovery
This
plan.
is a recovery. This is your own recovery plan. This is something that you get to build for you. Like that is what I am letting, you know, my peer specialists that work with us is that we're on that. Let's develop your own recovery plan. What does that look like? What are some skills or grounding techniques that would work for you? Because not everybody does journaling, right?
Yeah.
And when it comes down to it, I'm not going to just pick up a pen and write down something. Like I have got to maybe go to the restroom and wash my hands under some warm water.
So
like that's a different technique.
The recovery plan ought to be pretty easy for you. You guys got Sean McCowan over there too. So the recovery plan, I mean, didn't he just publish a book?
Yes, he did.
We're actually in the process of getting that workbook to be part of our programming.
Yeah.
So every one of our patients will get one of those workbooks when they get on the unit.
Yeah, that's pretty good there. That's pretty good.
And they start that process from day one. I mean, as soon as that patient hits the floor in our unit, we are talking to them about what long-term recovery looks like for them.
Yeah.
Because we give them tools, but they got to figure out how to get out. They got to and implement them in life, because when you're living life on life's terms in actual reality, you're not closed in by the four walls of a hospital.
Absolutely.
You got to know what to do.
What if you had to overall pinpoint the strongest component that makes Bradford Health and St. Vincent's, this program, different than any other treatment provider in the state, what would it be?
Well, I think we're able to give the full continuum of like medical care. So, for example, we have a patient right now that's having some heart issues on our floor, and we don't have to discharge him to go get help. Like they're getting
You just call him on in.
They're doing an EKG on him and starting on medication. He doesn't have to leave treatment. We had a patient that needed the COVID vaccine, a second vaccine, and that one was a little bit trickier, but we worked around it. So, I mean, I think we're able to, we have nursing care that's going to be able to treat the physical component of the body. We have the therapists that are kind of doing the mental, and then you've got the peers doing all of it, all of it, all the things again. So I think it's just that we have a very professional program, and we have kind of a standard that we want our patients to get well. And I think everybody does it's trying to do that in treatment, but being in a hospital setting has its challenges, but I also think that it has a lot of benefits, and that we can pull in all the different resources that the hospital has to offer.
Man, that's awesome, Dori. So we always like to give our guests the last couple of minutes, and Jason Bolin is asking, what is the name of the book, the workbook Sean published?
Something recovery workbook. Sean's on, maybe Sean can answer.
Yeah. Sean, type in the name of your workbook. It's on Amazon. I know that. You can buy it off Amazon. It's some kind of personal recovery action planning.
It's recovery action.
It's like
And
rap.
it's evidence-based,
Yeah.
so it is. I believe, supported by SAMHSA.
Yeah, rap planning is for sure. And so it sounds like Sean just wrote a simpler way for it. You know, a lot of times when it comes to recovery, they use complex language, and so for you guys, the cool part is you have peers, and one of our founding concept is that we use simple, easy to understand language, and the concept behind that is exclusive vocabulary is useless if I have to explain what I just said constantly. And so and people in early recovery, they don't identify, violence and aggression as a lack of self-control, locating weakness in the mental capacity. They're like, oh my, stop. But if you say, hey, listen, you're supposed to be feeling a little cray-cray right now, because that's what dope does.
You're absolutely, things, they're going to level out. Just letting somebody know, like, hey, you're okay. You are okay. I've been there. Like I was talking to somebody, so the cool thing is I get to go to different floors and meet with peers and be able to identify with them right where they're at. Like I've been in institutions, jails for many years of my life, right? Like I was made to believe I was sick, and I wasn't. Like I'm able to hold down a job. I'm able to go to work. Like I don't have to hustle the government or whatever, because that's the way that I was, taught. And so now and they're like, wow, like, you can help me. And I'm like, yeah, man, like, we can get you some help.
Yeah,
like,
for sure.
Yeah, and it's cool. It's really cool.
I think what's nice is making that promise and knowing we can deliver it. I mean, that's You
Yeah.
know, I think a lot of times getting on tells me, well, we can help you, but,
Right.
and even if it's somebody that cannot come to our unit, our
Yeah.
peers are still
We
working
work
with them
hard,
to get them
yeah.
somewhere that they can.
That's
So,
cool. That's
You know,
good
we
stuff.
don't just drop that patient and say, sorry, you don't
Yeah.
have the right insurance, or you don't have the right, you know, you're not gonna meet criteria. I mean, they do a soft handoff to other treatment centers or to other
Sober
facilities, sober
livings.
living, you know, whatever it is to make sure that that person that's seeking help gets it.
Yeah, that's awesome. So what would you like to say to our viewers, Dori, in closing?
Thank you for supporting us. I mean, I think that's, you know,
It's good stuff.
that's it. Like, we're only as good as our program and our staff and our patients and the community. And I think you know, coming in and opening up a new program 6 years ago, we were welcomed by this community. And I think that's really nice, and it's been a huge deal, and we've seen other treatment centers come in and support us and building those relationships, which I've been a clinician for 21 years, and unfortunately the reality of addiction is that a lot of times treatment centers don't want to play nice with each
Yeah.
other. It's real competitive, and we kind of came in without that attitude and saying, let's do what we can to make our community better, and
Yeah.
the community accepted us. So I would say just thank you for supporting us and being out there, and think of us. You know, when you have somebody that wants help, give us a call, please, because, you know, we do
good.
need to keep the doors open, but more importantly, we like to keep knowing that people are getting recovered.
Yeah, it's awesome. Misty, what would you like to tell them?
I would like to say just never give up. So never give
Yeah.
up, no matter what, no matter how many times. If you fall, you know, you just keep getting back on that horse and riding.
That's
You
good.
just keep going. Don't give up and reach out. You know, that's all I can say.
That's awesome. All right, guys. Well, I hope you had a good show. Thank you for everybody who followed and liked the page and the viewership. And we will see you next Wednesday at 11 a.m.